Well, it has now been 6 months since Canadians have been wearing masks, cleaning their surfaces, even quarantining their food, and maintaining about 2 meters of social distancing. But the question is now, with the evidence in, which of those methods has actually worked to help contain the pandemic?
So if both people are wearing a mask, you're now way down to about sort of single digits in terms of percentage. You've removed the 90-something% of the risk.
Despite initial concerns, evidence gathered since March shows that masks have worked, particularly in areas where multiple people wear them. But the science confirms that there's actually one safety method that trumps all others.
Distancing, of course, is going to be the biggest protection. For most purposes, proximity means about maybe it's between 1.5 and 2.5 meters.
That distance is important because most infections are still transmitted by small droplets from breathing and not just large drops of spit.
What leaves your mouth is a virtual cloud. And within that cloud, you're getting droplets of every size, from the absolute minute down to sort of a 1/10 of a micron, right up to 10 microns.
But despite that potentially moving cloud, concerns about the virus on counters or doorknobs has ebbed. Research finds that the virus has a half-life of just 6 hours on surfaces, and the amount transferred is typically lower. But that doesn't eliminate all transmission risk.
Somebody still sneezes in, covers the nose with their hand, and then you touch the handrail at Bloor and Yonge subway station. Everybody else that morning who touches it is going to be receiving some of your virus.
Then there's the question of testing. A large number of infectious people will still be asymptomatic, which Sly suggests means we should up our efforts. But internationally, we're trailing the pack.
We are behind Portugal and I think Saudi Arabia in terms of our testing. We are 40th in the world position in terms of tests per million.
Ultimately, Sly says we don't know the impacts of COVID heading into the flu season, hence the need to keep masking up, keeping our distance, and cleaning if necessary, especially since the hope for a magic bullet could still be more than 6 months away.
There might be some early vaccines going into arms in the fall and early winter. It's possible, but don't count on it.
In Edmonton, Courtney Theriault, City News.